15 minutes before 6 o'clock now, and the Ohio soldier accused of a shooting rampage in Afghanistan is expected to be charged yet this week. Revelations about Staff Sergeant Robert Bales paint a portrait of multiple deployments to war zones and financial stresses here at home. Now, I spoke with the man who heads up Dayton's VA program designed to help those like Sergeant Bales.
My first reaction was to kind of wonder about what kind of things had preceded that event.
Bill Wall doesn't know Staff Sergeant Robert Bales, but he's worked with war veterans who've been deployed multiple times and who suffered similar injuries and stresses as the Ohio soldier accused of killing 16 Afghan civilians.
It's just like any other injury. If you keep re-exposing the person, then one could expect that it's just going to make the problem worse. Now, folks have been able to redeploy and be 100% in their functional capacity at work in terms of their ability to do the mission deployed, but it gets more difficult.
Wall, who spent time in Kuwait as a lieutenant colonel in the Air Force, now oversees the post-deployment clinic at Dayton VA Medical Center. Wall says since the Freedom Center opened in 2007, 2,000 veterans have received help with physical and mental health fallout from serving multiple times in Iraq and Afghanistan. Wall says the center never turns away anyone.
I think we can establish when a person's had too much, and we need to be responsive to that and then take them out of the fight.
In addition to the work going on here at the VA, there is now an effort being made to reach out to doctors in the civilian world, those who might come in contact with people who have served multiple times in Iraq and Afghanistan. And what can we do? We can welcome troops home and say thank you, but beyond that, Wall suggests we simply connect with servicemen and women who are trying to find their way back into some sense of normalcy.
So when people are walking down the street with their dogs, say hi. Right? When they are looking at that person cutting the grass, help them out. You might want to hear their stories, but really it's just making them a part of it. It's that making people feel a part of their community that's probably the biggest help.
And he told me if you recognize someone is struggling, you can make sure he or she knows help is available. The Dayton VA number is 268-6511, and the Veterans Crisis Line is 1-800